Let us talk about the developmental disturbance of structure of the teeth. Initially, we will talk about the developmental disturbances of enamel formation, followed by dentine formation. In the last part, we spoke about enamel hypoplasia of environmental causes. Now we will discuss about the hereditary cause of enamel hypoplasia. It is also called as imperfect formation of enamel, hence the name amelogenesis imperfecta, called as hereditary brown opalescent teeth. As we are aware, we have 22 pairs of autosomes and two sex chromosomes, the X and the Y chromosome. Most of these are having a Mendelian type of transmission, which can be divided as autosomal dominant, recessive, sex-linked dominant, or recessive. It can also have a multifactorial or polygenic type. So whenever you have a genetic constitution of an individual noted like this, which chromosome what is available, we call it as genotype. But the character which each of these genes represent, the facial form, the hair type, the tooth color, etc., all those are called as phenotypes. So in a person with a genetic disease, you will have genotype and phenotype. A genotype is a genetic constitution of the individual. Phenotype is the character of the individual which is observable. So most of us are actually looking at the phenotypes. We look at a person's face, look at the person's teeth, hair color, shape of the head, etc. So whenever we have a mother and a father having two sets of genes, you have an affected gene in only one person, then you have 50% chance of having a diseased individual. This is called as autosomal dominant because the presence of one allele of the chromosome is sufficient to cause the disease. So hence, this is the type of transmission called as autosomal dominant type. The autosomal recessive type needs to have both mother and father being affected. So if only one person is affected, the normal gene, in this case B, will control and not allow the phenotype to be visible. So if you have an abnormal gene from mother, the father's gene is able to give the normal appearance of the individual. In autosomal recessive, you need both mother and father to be affected, where you have 25% of the times the child will be affected by that particular trait. So we have discussed this before also. Same thing will be there for X-linked condition, but the only change would be we will have to worry about males and females separately. So if you have a mother having an affected allele, the female will always be a carrier because the father's X will be counteracting the affected X, whereas a male will have always the disease. An example will be hemophilia. If you have affected mother and father, that is the only condition in which you can have a diseased female. After knowing this, we should understand why we are talking about genes in amelogenesis imperfecta. Most of the amelogenin proteins are coded by the X chromosome located at the short arm 22. There are defects in the ectoderm which give rise to changes in the dentine pulp and cementum if occurring very early in the development. Since it is affecting the ectoderm, most of the time only enamel is affected. Dentine pulp and cementum are normal. Again, all the different types of transmission is possible in amelogenesis imperfecta. Let's look at the analogy of tooth formation. The tooth formation is compared to the formation of the road using concretized material. You have iron or steel rods which form the matrix. Later on you pour the crystals, that is the cement, and then you mature the crystals. Similarly, in the enamel, in the first stage you have amelogenin being deposited. Second stage you have hydroxyapatite crystals being deposited. In the third stage you have ameloblasts in the maturative phase, giving rise to maturation process, that is the smooth and the rough form mature the enamel. So when you have a defect, you can have a defect in the formation of the matrix, in the formation of the crystals or in the process of maturation. Hence, defects in formative stage called as hypoplastic amelogenesis imperfecta, defects in the calcification called hypocalcified amelogenesis imperfecta, defective maturation stage called as hypomaturative amelogenesis imperfecta. Hypoplastic type constitutes the major component, accounting for 60 to 73%. Hypocalcified type counts to only 7%. Hypomaturation type accounts for 20 to 40% of the cases. There are, however, combinations of hypoplastic and hypocalcified and hypoplastic and hypomaturative types. So let's have a look at this particular radiograph. This is a normal radiograph where you can appreciate the enamel having very opaque appearance compared to the dentine and the cementum. The pulp is radiolucent in appearance. But in cases of any of these hypoplastic, hypomaturative, or hypocalcified structure, this delineation between the enamel and the dentine will be lost. As you can see here, there are different types of amelogenesis imperfecta: the hypoplastic type, hypomaturation type, hypocalcified type, and a combination, which can have various modes of inheritance. Let's have a look at hypoplastic type. In hypoplastic type, the matrix itself is formed less. But whatever matrix is formed, the mineralization and maturation is taking place normally. Hence, you will find a normal looking enamel which will have a good contrast with the dentine. In this, both the deciduous as well as the permanent dentition may be involved. You will appreciate generalized pitting occurring throughout the teeth, and between the pits you will have normal looking enamel which are hard and does not have any penetration by sharp instruments. Hypoplastic amelogenesis imperfecta can also have a process of lionization in which one of the X chromosomes gets inactivated and usually associated with X-linked dominant type. On the 16th day of the embryonic life in females, one member of the pair is inactivated in each cell. The females are mosaics which will have a mixture of both the cells, the maternal X chromosome and paternal X chromosome. So in one person, mother's X chromosome, in one area, mother's X chromosome will be active. In the next neighboring area, father's X chromosome will be active. So the area where the normal gene is there, it will have normal enamel. The area where affected gene is there, it will have affected enamel. It may also appear like hazy brown patches seen on the tooth. But whatever be it, the enamel looks normal, and when you take a probe and poke on these enamel, it does not chip off. The hypomaturation type is the worst kind. This is the second most common type. There is defective maturation. So whatever enamel is being formed, it's not hardening enough. They don't reach the 96% mineralization component. So the density of the enamel is lesser, and you will have easy chipping and discoloration of the enamel seen in these conditions. In the hypocalcified type, as you can see in this radiograph, you cannot differentiate much between the enamel and the dentine. There is no calcification or mineralization occurring. There will be very similar radiodensity and very easily chipping off. And the patient will have high degree of sensitivity, and the tooth will be brownish color because of the exposure of the dentine. The combined type, you will have some areas where enamel is formed, some areas where enamel is not formed. So depending on the predominance of which type, the severity of the disease is decided. There's a syndrome called as trichodento-osseous syndrome, where you have curly, kinky hair, osteosclerosis, brittle nails associated with taurodontism, which is seen associated with amelogenesis imperfecta. Usually there's no treatment for amelogenesis imperfecta, but you have to take care about the sensitivity. You can actually prepare crowns for all the teeth, hence may have normal life in chewing and speaking process. So in the next part, we will talk about developmental disturbances of the dentine.